So you ever been to the hospital and you hear an overhead activation and wondered what it was? Well, here's some common activations and what they mean. First one is code blue. You'll hear this one activated overhead, a bunch of dings and ringing going on, and then you might see people moving with a purpose or running. That's because this is very important. It's a cardiac or respiratory arrest, and they have CPR in progress and they need all hands on deck. So there's like a certain team that's part of this code blue, and so you'll see multiple people responding at once. The next one is code red. This one is for fire. So you'll see a bunch of lights start flashing, the fire safety doors will close, the alarms will be going off. Most of the time it's a false alarm, but it's good to have it in place just in case. Most of the time it's someone overcooked their food in the break room in the microwave or something and it caused the fire alarm to go off. Code gray is another one that's used pretty often. It's when you have a combative patient. So this is an activation for security, but honestly, if anybody's in the area that can help, a lot of people will respond to this to help because usually a patient is getting combative with staff and they need immediate help. Code Crimson is another one that we use. This one is for mass transfusion protocol. So say someone comes in with a bad GI bleed, trauma patient, they're rapidly losing blood and we need to replace it. We'll overhead a Code Crimson because what this does is it activates the blood bank to do uncross-matched blood. And instead of waiting for like a typing screen, so where we can match your blood, you'll be like a type A, B, AB, O, something like that. You're getting uncrossed blood because you're losing it too rapidly. Another activation that you hear, it's not a code, it's just they'll call rapid response overhead. And what this is we have a rapid response nurse within the hospital that goes to patients that are rapidly declining or decompensating and they need immediate intervention. So the overhead page, what room they're in, rapid response nurse will go and try to intervene and help prevent them from becoming a code blue or something like that. Code star is another one that we hear a lot overhead. This is just a patient fall, so it means someone who was maybe a fall risk or maybe they weren't a fall risk, but for some reason they fell and they might have injured themselves, so they'll activate an overhead. This is important because the hospital becomes liable if they were to get injured. So they make a big deal of this, and that's why there's a code to activate it so they can get a lot of people responding and attend to this patient. All right, this last activation overhead, we don't use it anymore. It's just, this is funny for all my ER nurses out there. So we used to call a condition yellow when the ER was oversaturated. That is always the case now. So they've literally taken that away from us because it doesn't do anything anymore. So back in the day when I first started, when we weren't over inundated like this, if the ER was getting too busy, we would call condition yellow and they would send additional resources to help, or people would go over grid to help offload the ER's patient volume. But now that we're in this modern day where everything is always packed full, that condition no longer exists. Before I end, I should say a little disclaimer that these are all activations that we use at my hospital. So some of these may be different for hospitals that you're at or whatever state you're in, but these are the ones we use where I work.